By the start of the 20th century, the major problems facing surgeons had almost completely been overcome. James Simpson and his introduction of chloroform as an anaesthetic had overcome the problem with pain, and Joseph Lister introducing carbolic spray and aseptic surgery had overcome the problem of infection. But bleeding was still a problem, patients losing so much blood during surgery and replacing that blood. Now, Joseph Lister had done a little bit to try and overcome this. He had worked out that if you tied up veins using aseptic catgut, that actually reduced infection and reduced blood loss than the previous technique introduced in the Middle Ages by Ambrose Paré of just tying it with a piece of cloth. But there was still the problem of once the blood had been lost, once you replace that blood for a donor, quite often the patients would die and people didn't know why. But in 1901, scientists discovered that there were different blood groups, and they realised that you needed to match the blood groups of the donor and the patient so that they wouldn't reject the blood. And so that greatly reduced deaths from blood loss. But they still didn't know how to get the blood from the donor to the patient. If the donor was there in the operating theatre, that was fine. But otherwise, the blood usually coagulated and clotted before it could reach the patient. And when the First World War started, this was a huge problem because there were so many patients with their injuries and so much blood loss that they just couldn't have the donors there on hand to replace the blood. So they worked incredibly hard to find a solution to this problem, and they discovered that you could actually separate the corpuscles, the molecules that make up the blood, from the liquid that they travel in, the plasma. And you could freeze, you could put on ice the corpuscles themselves, transport them, and then when they get to the operating theatre, if you mix it with a saline solution, this could be used to replace the lost blood by the patient. So this greatly reduced the number of people dying from blood loss. There were also other developments during the First World War as well. X-rays were used widely by doctors across the Western Front. Now, they had actually been developed back in 1895 by a German scientist called Wilhelm Röntgen, but he didn't realise the medical application of his X-ray machine. But it very quickly spread amongst the medical community, and they realised its advantages for seeing where breaks had happened in bones, but when he had shrapnel or bullet wounds, to identify where the piece of metal, the bullet, was, again greatly increasing survival rates. During the First World War, you had many surgeons, many skilled surgeons, working close together in extreme conditions, doing, sometimes hundreds of surgical procedures a day. So, of course, the First World War greatly boosted the development of surgery. Great developments were made, for example, in skin grafts, with a lot of burns, burn injuries from explosions. And early in the war, they'd just put a piece of tin over their face to protect the wound. But they developed techniques of removing skin from other parts of the body, for example, from the backside, and stitching that on to the face with some very positive effects. There were also huge improvements in brain surgery. The first brain surgery procedures were carried out. Eye surgery developed, nose, throat surgery, simply because there were so many eye wounds, brain wounds, head wounds from the shelling that they worked out solutions to these problems. One problem they didn't overcome during the First World War was internal infection, because there was so much mud in the trenches, and bullets and wounds would carry dirt and infection deep into the body, that they had difficulty dealing with this. But it meant that after the First World War there was a commitment by surgeons to overcome this problem in the future.